dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. Today, our topic is going to be about the Safe Station programs and how it pertains to the opiate epidemic. With me today is Mayor James Donchess for the City of Nashua. Welcome, Mayor.
Thank you, Yvonne.
In addition, we have Chief Stephen Galipeau for the Nashua Fire and Rescue.
Thank you.
Thank you for being here. And Peter Kelleher from the Partnerships of Successful Living.
Thank you, Yvonne.
And Chris Stawasz from AMR. Thank you all for being with us. Mayor, this is such an important topic because our city has gotten a lot of attention about it, as well as our state, as well as nationally, because of the campaigns and people being aware that the opioid crisis definitely is a problem here. And you have been very diligent in your concern about it. And let us know a little bit about, because I know you've done a lot within the city to address this. If you could explain it a little bit to us, that would be great, and how you arrived at wanting to come to start the Safe Stations.
Well, Yvonne, I'm deeply affected by the opioid crisis as mayor. I mean, I hear from a lot of, and have been for a long time, from the frontline professionals about all of the problems being created. Dangerous drugs being peddled on the street, criminals distributing and selling drugs, also our firefighters who are delivering Narcan, which is a anti-overdose medication, on a daily basis. Also, I hear from the citizens, the very terrified parent or grandparent who has a child or grandchild who is in the grips of addiction, the concerned teacher who is very worried that one or more students in their class have an addicted family member, which is just causing absolute chaos in their family, and from the grandmother who's very frightened about the fact that there could be a drug dealing in the next door to her apartment. So we needed to take action. Early in the year, we formed the Mayor's Opioid Task Force, and we're talking through the various approaches we could take. But we wanted to look at other successful programs, and one of those was the Safe Stations program up in Manchester. The AMR, which is the ambulance company in Manchester, is also our ambulance company. Chris Stawasz is very knowledgeable about the way this has been handled up in Manchester. So based upon the Manchester approach, we developed and decided, once the pieces were all in place, to move forward with the Safe Stations program.
That's wonderful. And Chief, can you explain a little bit on how the collaboration all came about regarding placing it in the stations?
Well, as the mayor said, early on he established the mayor's task force on opioids, and as fire chief I was one of the individuals that was asked to participate in that. We had many discussions leading up to the eventual starting of the process. There was a few gaps that we had to bridge before we could do it, and when we finally did, we were able to kick it off in November. But the program, it's available at all 6 of our fire stations within the city. Somebody that has that moment of clarity, they're looking for assistance, all they have to do is go to one of the 6 firehouses, ring the bell, knock the door, and our fellows will start the process and open that gateway to a recovery.
So are those fire stations open 24/7?
Yes, all 6 of them are open 24/7.
And where are they located in the city of Nashua?
We have one at 15 Amherst Street. We have one at 177 Lake Street. We have one at 124 Spitbrook Road. We have one at 70 East Hollis Street, one at 101 Pine Hill Road, and one at 2 Conant Road.
And they don't have to call before. They can just automatically just show up.
24/7, show up to a firehouse at that moment when an individual is looking for some assistance to get into recovery, and we will start the process with them.
Now, Chris, from your perspective in working with this in Manchester, what was the process and how effective has it been, and what do you see happening here for Nashua?
The Manchester model has been very effective. They're going to reach, I believe it's 900 people who have come through the program this month, December. They started in May, so there have been 900 individuals that have knocked on their doors since that began and have been put into some type of treatment program. So clearly very successful in helping people navigate the path to recovery, if you will. As Chief Galipeau mentioned, here in Nashua, we took a very close look at it, wanted to make sure that we understood what challenges Manchester faced when they put their program in so that we couldn't or wouldn't repeat those. And we worked very closely with the Partnership for Successful Living with Peter to develop the back end of the program, if you will, so that we had a very clear path as to where these folks would go to once they came through the stations. And we launched it on November 17th. We're up to almost 30 people who have come through the program so far.
Really? So tell us a little bit about your role specifically of AMR and what you do in that process.
Our role, the state of New Hampshire set up what they call a mobile integrated healthcare protocol, which gave ambulance services and folks who provide emergency medical services in the state the ability to apply for a waiver to be able to transport people looking for medical assistance to somewhere other than a hospital. Right now, if you call 911 and you're treated by EMS, you have to go to a hospital. The MHIP program allows communities like Nashua and Manchester to come up with alternative medical solution plans based on need to develop programs like this that'll take folks out of the emergency room where they really don't belong and direct them to the appropriate level of care. So that's our role in it. We provide the paramedic level evaluation of folks. Anybody who comes in to a safe station program, the firefighters are going to take their vital signs, they're going to get some demographic information from them, they're going to make sure that they qualify to be in the program medically, and then our paramedics will come out and review that information. If they need to do additional tests to them, they'll do that, and then we make a determination as to whether or not they can go into the program or they need to be treated at a hospital.
All right, and that's where you come in, Peter, correct?
That's
so
right.
What is the process from your perspective? How did you get involved, and what are the services that are able to be provided to people once they're come to a station?
So one of the biggest challenges in the whole opioid crisis is really people knowing what all the resources are that are out there and trying to figure out how to access them. And our role is a bit daunting for a nonprofit organization, which is how do we make sure that we have a response at each of the 6 fire stations 24/7 within a 15-minute period of time is what we're endeavoring to do. And it's something that our staff has really risen to the occasion, and we get to the fire station and we transport the individual or who has come with them back to our Maple Street location at 14 Maple Street, where staff there try to make people feel comfortable, and we immediately try to get them connected up with a licensed alcohol and drug counselor evaluation. And then from there, we try to figure out what is it that this person needs amongst the different array of services that are available. And there are quite a few, thanks to the legislature that's been helping to provide additional resources to help agencies like ours put up new programs to address the issue.
Chief, I was wondering if you could tell us a little bit about what you look for. What's the criteria that you look for as people come into your stations?
When somebody comes into the firehouse requesting assistance to get into a recovery program, we start with a basic patient assessment. It's basically we're checking their vital signs, making sure that they haven't spiked a fever. We want to make sure that they don't have any other medical conditions that would complicate things when they get over to Harbor Homes. And if they don't meet the criteria medically to be moved over to Harbor Homes, they get brought to one of the 2 emergency rooms in the city of Nashua.
And is that at that time, Chris, that you're contacted and you do the transport, or what is the role that you'll play in that situation when somebody needs medical care?
Our paramedics go to every call, so we'll come to the fire station and talk with the firefighters, look at their assessment, and then our folks, our paramedics, which are our advanced life support provider personnel, will evaluate the patient and concur with the fire department to make sure we're absolutely certain that the individual doesn't need to go to an emergency department and that they will be stable when Harbor Homes comes to take care of it.
Now, I understand that there has been very thoughtful training that has been provided to the firehouse station staff, correct?
Yes, over and above our normal EMT training, we've provided another layer of training with regards to substance use disorder and just a 10,000-foot view of, what a counselor or peer coach would see and how they would deal with an individual at that moment when they're at their clearest thought and they're looking for help. The 5 or 10 things that you definitely want to say, to keep this ball rolling forward.
People normally come in alone or with someone?
It's been our experience that folks have been coming in with somebody else, whether it's a family member, a loved one, a friend. They've been coming in with somebody else.
And Peter, you were saying that you also are 24/7 based upon the services that you've provided, and that your agency has really come up to the snuff to be able to do that. That's not an easy thing. So the types of services that you're providing, are your staff, they transport over to you at the Maple Street office, you were saying, and how are they being then assessed by your staff, and what is the process that goes through then?
Right. So our staff go to each fire station, and we transport folks back to our Maple Street location, most generally, and they immediately get connected with a licensed alcohol and drug counselor who can try to assess what is the correct array of treatment options for that individual person.
Right then and there when they arrive at your facilities?
Right.
Wonderful. So there's staff right there ready to assist.
There are staff right at the Maple Street location, and then they have a remote LADAC that immediately does an assessment.
Excellent.
And then from there, if a person needs additional form of substance use disorder treatment, then we may bring them to one of our other locations depending on what they may need.
And those locations are also open 24/7 so that they're not going back out on the street and they're not feeling
Right.
as if they're not being cared for. They're actually getting the services that they need.
Yes, and you reminded me as you talk about just the state in which so many people come in. Basically this is a magic moment in someone's life where they've made a decision, a hard decision, to try to seek help. And it's the work that's being done here is really so important that the firefighters are doing and making their stations available. The fire station is a point of safety that we all have in our heads, that it's how you can really get a pathway to care that you need in your life. And so our staff will take folks if they need, say they have a need for some additional medical care. We have a newly opened facility called the Peggy and David Gilmore Medical Respite Center, where we have 11 beds at our 45 High Street location.
Wonderful. Did that recently open?
It did.
Wonderful. And what are the services that occur there?
Well, we have our licensed registered nurses that are on 24/7, and those folks are looked at in an integrated manner. Is there a medical issue that has to be addressed that somebody might be coming in? Are they connected to all of the different services that they might need? What form of substance use disorder treatment might they need, and how can we access that for them?
Now, is this a temporary solution?
It's a way along the journey towards somebody's recovery.
So is it something, there are some facilities where people need maybe to go 8 weeks or more or months.
Yes.
Does this happen here? Or?
So it could. So just because somebody has a substance use disorder, a serious one, it doesn't necessarily mean that they may need a long-term treatment. Everyone has to be assessed. And We have about 7 different pathways that somebody can go down. Some folks might simply need to have an outpatient counselor and come in for an hour or 2 a week and meet one-on-one with somebody. Other people really need to have more intensive services, and they might have what's called an IOP, intensive outpatient group. And that's usually about 12 to 14 hours a week. Or we have other people that really might have more severe needs for treatment, and they go to what's called partial hospitalization, and they might have service for 20 hours a week. And those are all programs that can be done on an outpatient basis.
Through your facilities?
Through our facility. And then in addition to that, they may meet with our physician, and it might be determined that they may need medication-assisted treatment, which is a preferred remedy for many folks that have been using opiates in a very intense way for a period of time.
And what about if someone is homeless?
If somebody is homeless, that's part of what we'll assess, and we have capacity to immediately assist folks that are unstably housed or need to have the safety of a roof over their head. That's one of the things that the Maple Street staff do kind of right off the bat when they meet with someone, is they figure out, where have they been living? Do they have a place to go? And how has that impacted their substance use disorder state as it is now?
That's excellent. What are the greatest challenges to this? Because this is so phenomenal that there's been such a great collaboration related to this. Mayor, you must be very pleased, and all of you very pleased that you've really worked together to establish something like this. Are there
the dedication of everybody involved is extremely high. And
yes,
I think
and the commitment.
And everybody else in the community is really appreciative of everything that's going on. Now, our firefighters have been involved with the opioid crisis with heroin for quite a while. Since April of 2015, firefighters carry Narcan, the anti-overdose drug, on every medical call. The fire truck responds to every medical call, and so since the Narcan administration began, the fire department, on average, has administered Narcan more than 30 times a month. So it's around once a day or a little bit more. These are probably all people, so this is hundreds of people, who all could have died were it not for the fact that someone, in this case the Nashua Fire Department, has arrived to help revive them and really save their life. Now AMR also responds, but it's, and you have Narcan as well, I think, but the fire department often is the first one on the scene, and they are involved with saving people's lives all the time.
How have Southern New Hampshire Medical Center and St. Joseph's Hospital been part of this collaboration?
Well, they've been a very important part of our program thus far, from providing medical direction for the development of the program to seeing the patients that we do have to bring into the emergency room. One of the key components of the program is we want to keep people out of the emergency room. Some folks are looking to them now for seeking treatment. And this is a more effective alternative that points them directly into treatment with Harbor Homes, so they are not in the emergency room.
And when someone comes to you, Chief, are they responsible for paying for the services at the time that they enter? How does it work?
No, there's no charge when they come to a safe station. It's, as I said earlier, come to any of the firehouses, you knock on the door, ring the bell, and we'll follow the process that we've started with patient assessment, contacting AMR, contacting PSL, Harbor Homes to come over, and then when that individual has been medically cleared, they're going to go with Harbor Homes, and there is no charge for that service.
So from your perspective, Peter, people will not be charged for the services once they come to you?
Right. We're a federally qualified health center, so anyone who's trying to access our services are given service. There is a sliding fee scale if you are somebody that has no means or resources to pay for services, and we have other sources of funds to pay for folks that have no insurance at all. So there is, if you have insurance, and it can cover the service, there would be a charge depending on what particular service would be offered. But as a federally qualified health center, we turn no one away, and we are able to offer a full array of services.
That's wonderful. Now, you've started this process in November.
Correct.
This 2016. Beginning of November?
November
17th.
And since then, how many people have been utilizing these services?
I believe the number is actually 29 people have knocked at the door of one of our firehouses looking for an entryway into recovery.
Wonderful. And they do this with complete understanding that they truly are safe. They don't have to worry about police or anything of that regard, correct? That's why you went with this whole aspect of safe station.
I think that's the genius of the Safe Station program, is that, first of all, it's simple message. People know where people know what the fire department is. They know where the stations are, at least one. And they feel that, that the firefighters are there to help people, and they feel comfortable going to a firehouse. Whereas if they were given more complicated instructions to go to a particular agency that they've never heard of, or go to the police department where arrests take place, they may not be as interested in participating.
So therefore, the safe station, which I think from a psychological mental health point of view is really critical and really important, because when you said before, it's that significant moment where someone decides, the magic moment where they decide that it's time, that they really need help and they're reaching out, and then you respond. Now, from an aspect of outcomes, how are you going to track the outcomes and how well this program meets the needs of our community?
That's a great question, because we want to be able to look a year from now. Well, first of all, I hope the program, there isn't a need for it a year from now. That would be great. But we want to be able to look a year from now and see individually how each one of these participants have done, where they are in their substance use disorder career, if you will. Have they found employment? Are they successfully still not using drugs? Just how the system has worked and what we can do to improve it. We meet weekly to look at the numbers right now. A large group of people, including Mayor Donchess, have been there religiously, every Monday, talking individually about each case, and we look for opportunities to improve the process and look for ways to help more people.
So there's oversight and follow-up and tweaking as you go through.
It's definitely a work in progress.
If I could add,
Please.
of the 29 people that have come through the program so far, 99 different kinds of interventions or types of assistance have been provided to them. So they may have gone through, some 3 have gone into residential treatment, about 8 have gone into the Gilmore Center for medical detox, and the numbers just go on and on from there, with a large number going into intensive outpatient and partial hospitalization, and 3 have gone into medication-assisted treatment.
Now, interesting enough, Peter, I know from a residential point of view, it's been difficult for people to get care and get into treatment.
Yes.
You have mentioned a variety of 9 different pathways. I believe you said 9 different pathways. From your perspective, being someone who delivers care services to this community, do you believe that this whole process will, in fact, meet the needs of our community better than how we have been doing it before? Have we really now highlighted the most important needs and put into place the things that are needed?
I think what we're doing is kind of improving our ability to create access for people at this point so far. This is a partnership project with Harbor Homes and Keystone Hall, and 5 different programs under each agency that have now come together sort of behind the scenes to work as partners. And Keystone Hall operates a 54-bed licensed alcohol residential facility. So one of the biggest challenges is a shortage of residential beds across the state of New Hampshire. There's only about 250 statewide. So we're trying to figure out how to create more capacity in that regard. But I think it is one of the key avenues for how people achieve recovery. And our hope is that people will graduate out of residential programs and get into permanent housing or recovery-based housing, which is another sort of step along this journey.
So let's talk about that other step, because I think that people listening to this will get the whole gamut of reaching out and getting services, but realizing from the time of getting services that you're perhaps also helping them with housing and perhaps jobs and perhaps changing their lives and moving forward. So how are you doing that?
Well, as part of our overall assessment, when they come in, we have about 80 different programs now under the partnership, and we try hard to make sure when people are ready to hear about it, know about the different resources that are available, and do our very best to connect folks up to those resources. And there's another key resource that still hasn't unfolded in the community, and that's the creation of a recovery center.
Yes.
And
what's the status of that, and how is that going?
There is a group that's been identified here in Nashua that is hoping to have a recovery center in operation by the end of January.
Now, when you say a group, is that a collaborative group of people working together, or of a cross-section of different agencies trying to create this?
It's a nonprofit organization that's working in partnership with several other agencies and with the Mayor's Task Force as well. One of the roles that Harbor Homes has had is that we've been selected to be what's called a facilitating organization. So we've been in the process of setting up recovery centers in 10 different areas across New Hampshire.
What the recovery center does is for, a person maybe is trying to get back to life, back to work. The recovery center is a place where the person with former is recovering from substance use can go there and get counseling or just peer support and help in a less intense way, but over a period of a couple of years, because it takes that long to recover from a serious addiction. Right?
It's something you do with all your life.
Recovery coaching is what.
Recovery coaching and mentoring and supports. So it's conceivable for the listeners of this program to realize that they can reach out, get help, be put in connection with the resources to help them to deal with this addiction that they have, but not only help them to recover, but also help them to move forward in a path of a new chapter in their life. That's called hope.
Absolutely.
And that's called a whole new direction for them, which for a lot of people is so important, because they may feel that they have no option but to stay with what they've been doing. And if they're reaching out to you in this safe haven, which you're creating, you literally are opening the doors from a community perspective and saying, we as a community are here to help you in every way that we possibly can. That's wonderful.
I think it's a very courageous step that the mayor took in drawing a line and saying that recovery is possible. And that's what we're saying in all of this, is that recovery can occur. And I've been in this business of nonprofit trying to assist people for about 35 years. And in the time I've been here, I've seen so many people that you would think would never be successful in their recovery, and have made it and have been working and having vibrant, thriving lives. And
it's wonderful.
It's doing wonderfully.
Now, this recovery center that you were speaking of, is there a timetable that is being looked upon as to when that actually will come to fruition?
We're expecting it to be operational before the end of January.
Of 2017?
Yes.
That's fantastic. And so how will that play out in all of these services then?
Yes.
Tell us more.
All of these things are we actually have drawn a schematic to kind of figure out how it all ties together.
Wonderful.
But
wonderful.
Yes, the recovery, connecting folks to the recovery center is a vital connection for people in sustaining their recovery. And more and more people are learning to be trained as peer recovery support specialists, and as a specialized training, and it's all part of recovery centers becoming nationally accredited and having very successfully established programs.
Are they based on outpatient or residential also? Is it a combination?
Well, somebody could be in a residential program, but generally when you're utilizing the services of a recovery center, you're an outpatient at that point, and you're working on your recovery.
Could you give a little bit of a description of what that recovery center will look like and how it will serve people.
Sure. I think a recovery center, the one that they're envisioning here for Nashua, is one that would be warm, welcoming, accessible. Maybe they're talking about having like a small thrift shop or something connected to it, but a place where other people have been successful in their recovery will be widely available and at different times of the day. And just really be able to help somebody through the rough spots on their journey.
Now, if our listening members of our audience have someone that they think could benefit from this program or to go to the station, is there an emergency number? There is a crisis, New Hampshire statewide crisis line, and that number is 1-844-711-HELP, H-E-L-P. That's 1-844-711-HELP. What information do people need to provide when they call that number?
Well, this is actually a program that Keystone Hall, one of our agencies, has been operating since June 2nd. And when people call, they can call from anywhere in New Hampshire, and they are directed to resources that may be available in their area. If someone is in a crisis, the staff work and try to address the crisis first, and then try to figure out how to, as soon as possible, connect up with the different array of resources, no matter where they're from in the state. And I should mention that since we've started the program, June 2nd, we've had over 1,600 calls.
And that's amazing. So what are the nature of the calls?
Most of the calls are first from loving family members that are so deeply distressed about someone in their life that they're just really desperate in terms of trying to figure out how to access care. And then there are folks that are really scared and that they are deeply into abuse of opiates generally, and they're at that same sort of point that somebody might be when they walk into one of the fire stations.
So from a perspective of staffing, keeping the skills up for all of the people that are involved, are there continuing education and other supports that are there on all levels of the staffs that are involved in each of the aspects of this particular program?
Yes, in our case, we're mandated by the Bureau of EMS to have continuing ed credits with our EMS training. And what we've done this year is we've worked with the staff from AMR, and we've added a component that continues to bring more information with regard to SUD and how we can better serve the people of Nashua when they do come knocking on our doors.
That's so important, because we wouldn't want your staff, any of the staff, to ever become overwhelmed and not have the resources that they need to be able to handle this really wonderful but very courageous and outstanding initiative. So,
any family member who has someone who might be in the grips of addiction should definitely try to get them involved here, because the AMR has been keeping the overdose statistics for Nashua for quite some time now, since the beginning of 2015, I think. And so it tracks the number of medical calls as a result of overdoses. And the high has been about 45 in a month. But the fatality level has been up and down. But in October and September, there were 7 fatalities, 7 each month, 7 fatal overdoses. So you just never know when a person who is involved with opioids is going to die from an overdose. And therefore, I think getting help is something that everybody needs to try to get involved with, because there's really definitely lives at stake.
most certainly. So what would you want people to know and do?
Well, I would say show up at the Emmer Street Fire Station or one of the other fire stations.
And if somebody's not sure where the firehouses are in the city of Nashua,
Yes.
although at the beginning of the show I had rattled off the addresses, if they were to call 594-3636, that's the non-emergency number to our fire dispatch, and they can point them in the direction of the closest firehouse. If they live in the southwest quadrant or the western quadrant of the city or northwest, whatever, pretty much the downtown firehouses, if you Google Nashua Fire Rescue or Nashua Safe Stations, you're going to come up with Station 4, which is the East Hollis Street Firehouse, but we do have other firehouses within the city. So if you call that number, 594-3636, they can point you to the closest facility to where you are at that time. And again, once they come to the door, they're going to be asked one question right up front. You know, do you have anything that could harm yourself or harm us? And everybody that showed up to date has answered no. And then we bring them in and we start creating a bond. And that's what firemen do. Firemen become firemen because they want to help people. And for the last year and a half, there's been a lot of frustration because we've been going out on so many overdose calls and delivering Narcan at alarming rates. And it starts to wear on the responders. And now, in the last month, the buy-in to make this a successful program has been phenomenal. I have groups of firemen that are on duty that have been going to tour the facility at both of the Harbor Home facilities so that they can see the other side. When someone comes in and they create that first connection.
That trusting bond. It's about trust.
Correct.
Yes.
And they get a chance to speak with the family members, the loved ones that brought the person in, and see the fear in their face because they know that they're going down a really dangerous path.
Yes.
And the concern that they want their loved one to get some help. It's been really eye-opening for all the members of the fire department. And they want this to succeed probably just as much, if not more, than any one of us sitting in this room right now.
Go ahead.
It's been an honor for us to have about 65 of the firefighters actually come through and tour the facilities, and we're able to sense just how dedicated and committed they are to making this a real successful program.
Now, if anybody has trouble finding a firehouse, so if you think of Library Hill at the top of Main Street, there's a fire station, the Amherst Street Fire Station. You go up Amherst Street just a block or two from there, and there's the Amherst Street Fire Station. So anyone who can find downtown and Library Hill can find the Amherst Street Fire Station.
Why don't you, again, the addresses of the other fire stations? So we have the Amherst.
The mayor mentioned there's the Amherst Street Fire Station. There's a fire station at 177 Lake Street. There's a fire station at 124 Spitbrook Road. There's one at 70 East Hollis Street, 101 Pine Hill Road, and 2 Conant Road.
So the one where most people are responding in addition to Amherst Street is East Hollis Street. So if you know where the City Hall is, the intersection of West or Hollis Street and Main, you just go east from there about 3 or 4 blocks, and there's a huge fire station on the left.
Is there? I know sometimes it always helps me if there's a particular a shop or something, some identifying symbol that's nearby. What would they recognize?
The Lake Street Firehouse is literally 1 block right behind St. Joe's Hospital.
That helps, see? This is good.
Spitbrook Road Firehouse is just up from exit 1.
Okay.
Instead of taking a left to go to DW, take a right.
Okay.
Spitbrook Road Firehouse is right up there by Roby Park.
There you go. Okay.
Conant Road is off of 111A heading towards Captain's Corner.
Okay.
And the Pine Hill Road Firehouse is right at the airport.
And East Hollis Street, very near McDonald's.
Very good. You see, this way it always helps people. Now, from a city point of view, on your website, has the city placed this program and the fire stations on the website?
We have it on the fire department's webpage on the city website.
Excellent.
There's an area where they can click on it and get some information.
So they can get information to know about the program and what they can do and where they can go. And it's important for everybody to know it's 24/7. They don't have to call. All they have to do is show up.
Show up.
They can call. Now, one thing we haven't mentioned is that in addition to the 29 people who have shown up at the fire stations, about 30 have called the fire department, fire dispatch, and have been asking questions. Now, we think some of those people ended up going to a fire station, but they can contact the fire department via phone to kind of just, if that makes them feel a little more comfortable in deciding whether to report to a fire station.
And whenabouts do you find the highest usage right now as far as coming to you? During the day, at night, when people are having this?
I'm going to say most of them have been between about 3 in the afternoon and maybe 8 at night. During dinner hour, a little bit before, a little bit after. That's been the majority of the times that we've had somebody knock at our door.
And as the chief said, almost all of them come with a loved one, a brother, sister, mother, father. And it's really an amazing experience when you talk to these people, because they will bare their soul to you. They're at the ground level on their elevator. They are just ready for help.
Yes.
And that's the best time to capture them and bring them in.
Absolutely. Ages that you're seeing, all ages apply?
I believe the average is between 19 and 54 from the
So
folks
far.
that have come through. Yes.
But you are willing to see any age?
Anybody.
Any age, anybody.
Right.
That's very important.
And about half men and half
Yeah,
women.
it's running pretty close to 50-50.
And from a service delivery point of view, there are no restrictions at all related to age at all. You're open to helping anyone that comes through your doors.
Absolutely.
Very good. And for follow-up and oversight, once they come to you and your organization, they're helped every step of the way from going through the process and then into the next phase of recovery.
We track how someone is progressing, and we are also tracking after they've ended services, after 3 and 6 months after, in a year. That is our goal. We haven't gotten there yet, but that's the plan of how we'll track outcomes.
And from your perspective, as the chief has gone through and his staff continue with continuing education and training so that your staff doesn't get burned out, that they get the resources and supports they need, what's happening related to your organization and being proactive regarding that?
Sure. Well, we have a very robust set of trainings that occur as all of our folks are licensed, and there's a significant amount of continuing education that they have to maintain the license. But we also have stresses and pressures on all of our caregivers
Exactly.
to ensure that they are able to keep on delivering the important care.
And there's supports for them in place?
Right. We offer yoga,
Right.
and also to people who participate in the program could avail themselves to it
Wonderful.
as well.
Wonderful.
Many other things as well.
Very good. And from your perspective?
It's the same thing. You know, we have all of our paramedics are licensed. They are required to do a certain amount of continuing education. But for us, being able to participate in the program is really, it makes us more optimistic. You know, we see day after day after day, as with the fire department, that we're administering Narcan and we're really unable to help them beyond that point.
Yeah.
But being part of this program gives us hope, gives us a little shining light, if you will, to be
Absolutely.
able to do something for someone that we couldn't do before.
That's wonderful. So from your perspective, where do you see this vision going? What would you like to see happening here?
I think the number of ODs and fatalities going down to the point where they're not measurable anymore.
We agree.
And how are you getting this information out to our community? In the schools, are they aware of the safe stations?
We continue to work with the mayor's task force, and I believe that the next step in the process, now we've got an intervention piece in place. The next step is to further grow the prevention education side of this whole situation, and through that, we will continue to work to get our message out. The day that we started it, we had the press conference at the East Hall Street Fire Station, and we got a significant amount of media coverage from that opening. And since then, we've spoken on a number of occasions, and the mayor himself, myself, and then we spoke the other day with our national delegates about the whole program. And the more we just keep talking about it and getting the word out there, we also had some cards made up in collaboration with AMR. So if you go to an overdose call and that person's not quite ready yet, if you can give that card to a loved one. We actually had one situation where it worked, and the young lady went to the firehouse later on in the day. So it's best that we can get it out there through, we're working on some handouts, some pamphlets that we can hand out, maybe have them in different places, have them at the library, maybe have them at some parts of City Hall.
Grocery stores,
get them into the
where
schools,
people go,
yeah.
CVS's or barbershops, and
Absolutely.
All a variety of places.
I just want to say that I think for this program to be successful, it's really going to take the entire community. It's a big lift for everybody. It is really an epidemic. And I think with all parts of the community, other agencies that can step up and help and provide resources as well, would be most welcome in the process.
So how can they do that? What are the things that you would like to see in further collaboration from what you have already done related to other agencies and supports within our community?
Well, from our point of view, we would certainly welcome citizens to come and tour our facility, and they can sort of see firsthand what actually is going on, and they can also try to make sure that folks that they may become aware of that are wrestling with substance use disorder are pointed in the right direction.
So from an organization point of view, there are many different organizations within the city. It would probably be very beneficial for them to come and see exactly what you're doing, and also each of them having the information about where to go, even from the YMCA's to the PAL programs to every different type of program.
One of the things that we've started working with Mr. Ed Leachus in the National Police Department is we've started attending the community crime watch meetings.
Good. That's a great resource.
To get into each of the neighborhoods and get it out to the folks that go to those crime watch meetings. And I guess the way we look at it is not to sound corny, but if we tell two people and they tell two people, eventually everybody's going to hear it from somebody.
Absolutely.
So.
And I think most people would be surprised at the level of service that Harbor Homes has to offer in this community. And it's a worthwhile trip to go and take a look at what they do, because they do some amazing work.
Peter, for people to come see, will you be having certain open houses for people to be able to come, or can they just call your agency and come?
They can just call, and we historically have had a variety of different tours that we've done for folks, but we're happy to open our doors to anyone that would like to learn more about what we're doing. And it's most people walk away with sort of saying, wow, I had no idea that all of this was here.
It's very, very good. A lot of times people don't realize the treasures within our community. We have such a phenomenal city of Nashua, and it truly does, you said before, it does take a community to work together and do it. And Mary, you have shown such vision and foresight in really getting everybody together and working on this problem, because what we don't want is anybody to feel helpless or hopeless, and that there's no help in sight to help them go to the...
It's definitely a team effort. I mean, we know that the opioids have touched a lot of families.
They have, from all walks of life.
If you talk all walks of life, I was over at the Boys and Girls Club the other day. I asked them, the kids who come here regularly, what percentage of the kids have a family member who are involved with some kind of addiction, opioids? And their answer is like 50%, they think. So these aren't the kids that are addicted, but the parent, the uncle, the brother, whatever. So the families are just being, our families are just being, just totally disrupted and devastated by this, and that's why we think it's so important to try to do everything possible to put an end to it.
Yep, and I think that we are definitely on a wonderful path. So you see this growing, you see it becoming not only the services that you are now doing, but ending up also in the recovery aspect. So as we summarize what you have to offer, there are 6 stations within the fire department that are safe stations.
Yes.
And they are located where?
Amherst Street, Lake Street, Spitbrook Road, East Hollis Street, Pine Hill Road, and Kona Road.
Okay, and anyone can go there 24/7?
24/7.
And
the firehouses are always manned. If you go to one of the firehouses and they happen to be out on another incident, there's a number, there's a sign above the main entrance to every fire station that says safe station. And there's some verbiage there that basically will tell somebody that if the fire companies are out on a run, they can call that number, and we have the ability to send the next closest fire company to that location and help them get into the program.
And you mentioned that there is a phone number related to the fire department that people could call to find out exactly how to get to the stations or to have any questions answered.
Yes.
And that number is?
It's our business line. It goes to fire dispatch. Again, it's answered 24/7, 365. It's 594-3636.
And Peter, from your perspective of letting the community know of how you're helping to provide the services needed, what will they get?
If individual citizens wanted to come and see more of our facilities, they could call 882-3616, and I'd be happy to personally give folks a tour of what we do.
Excellent. And from an AMR point of view, what would you like people to know?
Well, certainly if anybody is suffering from an overdose or you feel like they're in need of immediate medical assistance, 911 is the proper number to call. We'll come out and assess you and take care of you and get you what you need. But I think the community in Nashua should be very proud of everybody who's gotten together and worked together to make this happen. If that's a silver lining to this epidemic, certainly has brought a lot of agencies closer together and made them one, if you will.
And that is so important. And from your perspective, Mayor, related to your vision and seeing this through, what do you want the community to know about this particular problem and other problems that come up and how you work together to solve it?
Well, there are people available to help with anyone who's involved with not only opioids, but alcohol or any other addictive substance, and we just want them to seek help. Help is available, and we believe that if they seek help, they can make it through recovery.
Absolutely. And so what the whole aim of all the community resources is to have people healthy and well and to have them live full and healthy lives. New Hampshire's statewide crisis line is 1-844-711-HELP, HELP, 1-844-711-HELP. I thank you all very much for what you're doing. I thank you, Mayor, for your vision and your insight, and I thank all of you for collaborating in such a way. What you are communicating to our community is something critically important, that you care, and that you want all of our community to be healthy and well, and that you don't want them to feel helpless or alone, and that there aren't any supports out there. That you as a fire department want them to know there's a safe haven for them to go, and that you take care of people, and that you have the resources there available to see them to provide the care. And if they need more than the care here, and they need medical attention or additional care, that you're working together. I thank you all very much for what you're doing. I really appreciate it, and I know as a community as a whole that we all really appreciate everything that you're doing. I thank you very much. Until next time.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.